digital dentistry is changing how we plan and execute treatment in a dental clinic. And to explain us more about it, we have with us one of the pioneers in digital dentistry, that is Dr. Aslam Inamdar. After completing his graduation from Nair Dental College and Hospital, he went on to set up two private practices, which is currently state-of-the-art and run by fully digital workflows. He has done 9 residency programs related to digital dentistry. Also, he has attended implant mastership programs with Stony Brooks in New York and Dental XP Atlanta. He has established one of the first unique 3D planning service centers and a fully digital dental laboratory in 2019. He has provided digital dentistry services and education to more than 800 dentists across the globe. He has conducted a huge number of digital dentistry workshops for dentists to understand the current copy-paste dentistry workflows, benefiting more than 1,000 professional practices. He has been awarded the Superstar Dentist of the Year 2019 and the Innovative Dentist of the Year 2024 from the FAMDent Awards. I'm Dr. Satish Kumar. This is Kaizen Dental. Our aim here is to help dentists succeed. Hi, Dr. Aslam Inamdar. Thank you for joining us today. So my first question to you is, when 10 years ago, no one was even thinking of the word digital with dentistry, what got you interested in it?
Okay. So to begin with, it's a very nice question as it is pertaining to digital dentistry. That is kind of now my hobby. And to be honest, I graduated in 2001, so probably 23 years back. And I was like just in dentistry, there was not much great things happening. Only the root canal part was a little bit innovative at that point of time because the rotaries was just introduced into 98 or 99 and profiles were started in that time. So as a dentist, we all were drawn into this new as a human mind, we always want to get attached towards what is happening currently in the new world of dentistry. And my interest after graduation were always into some kind of cosmetic dentistry because that is where the glamour is attached. No, that is where people start knowing you. So I was always fascinated towards these doctors who could do a wonderful job about smile designing and all that part. And somewhere deep down the line, I always wanted to be somebody like that or some way or the other way I could reach out that. And that was not happening till 2009 or 10. One fine day, I happened to attend FAMDent and I listened to Dr. Rajiv Verma, one of his sessions, and there he was mentioning about the DSD concept and inviting Dr. Christian Kochman from Brazil to India to talk about this digital smile design concept. And I was really, that the hunger of becoming a good cosmetic dentist, and there was no light around, and I could see something happening to me. I jumped at that idea to attend that workshop, which happened in 2012 in Goa. And I think most of the who's who of dentistry attended at that point of time. I was a little new, not really a fresh graduate, but overall the new person to attend that. And I was really inspired to see Coachman talking about high-end aesthetic work. And so from that time onwards, I followed everything about that is happening in digital dentistry. Unfortunately, at that point of time, nothing was moving in India as such because we were always a land-back country. We follow the Western world 5 years, 7 years. Afterwards, they have established on those protocols. And I was struggling to introduce such kind of work here. But my passion pulled me into that direction. I went across the globe, followed Coachman a lot, many times. Then a lot of other doctors who are doing so-called great digital dentistry. And that's how I could, put up all these workflows in the work, and I enjoyed it all, whatever is happening.
Understood. So, but you were telling me about India being 5 years, 7 years behind the Western world. So you would have had some difficulties other than just meeting people in the technological aspect. What were the difficulties you faced and how did you overcome them?
So, so the first difficulty as such, you would say, it is in the mind actually. First is that inertia of, nobody is doing it. Why should I do it? So there has to be some burning desire or drive. So probably I had that, and that made me to go away from the crowd and go it. Because otherwise, when I look at my friends, I mean, क्यों करना है सब चीजें? क्या जरूरत है? इस टाइप का patient हमारे पास है कभी और and they're not going to pay such kind of money for us. So why should one do it? So I think the going out of your comfort zone is a pain point for most of the time for the first times. But I did not have, fortunately, because of the drive. Second thing, when I was going out and trying to learn, obviously the financials is taking a toll on you. So that is also challenging, but somehow that desire made you to follow that path, even though there is a money or no money, someday you manage and go out and learn the craft basically. The another challenge from that onwards is once you learn it, you come back to the practices because you are delivering the work to the patients. But then you do not have the technology around you. There are no people who are providing you the technology. There are no people who are providing you consistent training on that part. So that was a challenging initially. Like, to be honest, if I tell you 2012, I did this first DSD course, and the first requirement on that was, you should have a PowerPoint. Now, in 2012, most of the guys were not having computers in the practice. We were of a generation where we never had a computers in our curriculum. So to learn the computers and the PowerPoint, that was challenging at that point of time. If I invest into the laptop and get a PowerPoint, the next challenge was to have a DSLR camera. Now, because we are talking about digital, smartphones came 2015 onwards. So before that, there were no smartphones. So if one has to do a smiling design project, you need a good picture. You can't take the patient to the nearby studio and get the picture. That was not the idea to go digital. You needed to have that equipment with you. So investing into a DSLR camera with good flash systems, learning about the camera was again a challenge for that point of time. There were mentors who are going to teach you about dentistry and digital photography. So that's how we started, I think. But somehow we could win through that. And there were Dr. Rajiv Verma and a few others who were keen to do that. We could pull it off the initial hiccups after that.
Understood. So you have gone through all this journey, you went through the difficulties and you started digital dentistry. But do you really feel digital dentistry adds a lot of value to the patient, whether it comes to patient conversion, satisfaction? How does it work? Before you listen to the answer to that question, if you are enjoying this video, please do not forget to hit the like button below because it will show YouTube algorithm that you like such videos in which you can learn more about dentistry and will keep showing you more of them.
Absolutely. Today, like the world with digital dentistry has evolved so much, and the challenges which I'm talking currently, they are not challenges for the current lot of dentistry. This is like a fortunate era for them, and there's so much of digital dentistry is waiting for them. So you don't need DSLR cameras, to be honest, in the practice, like unless you want to present on the big podiums. To start your practices, you already have the smartphones in the practices. Everybody has it. Sometimes our chairs and associates also have a better auxiliary staff also have a good smartphone with them. So taking pictures is like the key work. That is the beginning. Then you have the interval scanners in the practices. Even if you do not have a laboratories are ready to provide the scanners. So, practically you can make any information available in the patient's mouth in a digital format. And then that can go to the people who are experts and understand the process and work towards it. So I think today there are no challenges as such except the mindset to open our mind that digital is here and that is improving the quality of life for the patient, quality of care that is being provided to the patient by the dentist. So much of time and energy is being saved. So I think there are a lot of benefits from digital dentistry besides providing the quality, precision. Aesthetic dentistry has gone to the next level through this digital workflow. And today, you do not really need to have a great hand skills to provide the best aesthetic outcome. You need an open mind, understand the workflows, and there are a lot of things available out there. You just need to assemble them together and deliver it to the patient. That's how easy it is to manage.
So it is beneficial to the patient end, it is beneficial to the dentist end as well. But sir, does adding digital dentistry increase the time required or does it make your practice more efficient and quick?
Yeah. So I would say initially, anything you want to learn, there is a learning curve. That might take a little bit of time for somebody and for somebody it will take a little longer time depending on how open you are to adopt this new system. Once you make a habit of it, it becomes a routine in your practice, and the time which we are saving once you master certain protocols and certain things is next to the next level. Like suppose in analog world, if I'm spending 10 hours on the chair to do certain procedures with the digital technologies and understanding of digital workflows, I possibly can finish that work with much better quality in 4 hours or 3 hours at times, which is saving so much of hours of mind on the dental chair. So which is ease for the patient, like आ भी गया खत्म भी होकर चला भी गया. It's like सोच ही नहीं था कि इतने कम मैसेज में काम होता है, and that too to the perfection level.
Understood.
Definitely.
So there is an efficiency increase plus quality increase both in terms for dentist as well as the patient. So but now imagine someone is watching this video and has not much idea about digital dentistry. Imagine he has a patient who's walking into his clinic asking for veneers. Could you just explain the step-by-step protocol of someone who wants to work with RSD or the rich smile design protocol and do a
Right.
case?
Yeah. So I would say, Max, since you are asking for a smile design workshop or a smile design case discussion, today in my mind, it is not about smile design or anything. Today, it is all about 3D treatment planning. Because as we say, planning is everything. Like we have been planning this interview for so long, but it had to be planned to the date and all this format, how you come up and all this stuff. It is not made, it is a random work. For dentistry also, whatever dentistry you are doing to the patient decides the pain care management, it has to be planned thoroughly. The patient's problems has to be understood thoroughly. And then the final goal of integration of all this biological, functional, and aesthetic integration, all this combination, all this synergy has to be predefined first. So there has to be a final destination of goal. And while doing all this dentistry, aesthetics should be the byproduct of whatever procedures we are doing. That is what I have started believing in after going into so much into digital. No? So it's not only about smile designing, it could be the end product of that whole process, what we're doing. Now, if you're saying any French dentist wants to do this kind of work, how can one go without investing so much of time, money, and energy into it? And this where the idea was, whatever I learned over a period of last 10 years, 12 years, how could I make it beneficial for my professional colleagues and friends and all the patients out there to get the benefits of this dentistry? I thought of incorporating similar workflow like what Dr. Christian Postman initially proposed with the DSD concept and the Digital Smile Design Planning Center from Spain. Similar setup I started like 4 or 5 years back by the name of Rich Smile Design in India. And the idea of this planning center is it is the connecting link between the dentist and the dental laboratories. Currently, in analog world, what we are doing is we are doing all these dental procedures by ourselves, and in the end, we send all these scans or impressions, whatever way, to the lab and asking them to do a wonderful job about the veneers or indirect exclusions and expecting a wonderful results. This is where the missing link is. Somebody has to plan. First, the dentist has to plan, and if they are not able to plan because of not able to invest in so much of technology and infrastructure and gadgets, there is a need for somebody out there who can do a cloud-based dentistry, take all this data and provide the proper planning, which is not face driven, which is having a latest but natural restorations where somebody's natural teeth, which could already can be copied for so many other people doing this AI-based conversation combination. And there is a definitive workflow for this through the tablets that has to be followed. So this process is defined by the 3D Planning Center like Rich Smile Design. And the idea of Rich Smile Design is to help many dentists and many patients to incorporate all these innovations today. So we conduct a lot of workshops through our education series where doctors can come and understand how the digital data is to be collected, what files to be sent to the planning center, and how when you go back, whether it is veneer case, implant case, aligners case, prosthetic, any kind of case or interdisciplinary action, how to utilize all these planning tablets. And once you do your dentistry and prepare the teeth and you want to finish with the veneers or whatever material, the final files again go to the planning center first. They will mix match all this data and give you the final copy pasting files. Now these STL files will be given to any dental laboratory or in-house milling machines or our own dental laboratory. They can copy paste and then the same work can be given back to the dentist by the laboratories now, which is as per the plan. And that's how we deliver the predictable dentistry to the patient.
Understood. So basically, before the the dentist starts the treatment, he has to send data that includes photographs and a scan to the Rich Smile Design team, who analyze the case, come up with how options and how the final finishes. Once that is approved by the patient and the dentist, then the entire treatment plan is started and executed as per protocol. So the advantage here is basically you do not try out first and then go and patchwork it. The entire end goal is first taken into consideration, and then we go step back and we do it as required. That's a very good idea because a lot of people don't do that. Majority of dentistry is just go ahead and then we'll manage on the way.
Yeah, I've been doing this I did this for my first 10 to 12 years before getting into the good idea about digital dentistry. And I can connect the dots where things are going wrong and where needs an improvement. So this phase of copy pasting and template-based dentistry is what I believe is not just current time, but this is going to be the future and only future for dentistry.
Understood. So now someone who is maybe old school, not used, as you told, computers or does not have idea about all this, how easy it is
Right.
to use if the dentist is not tech savvy, and can he train his staff to do all this stuff?
Yeah. So frankly speaking, when I'm talking about digital dentistry workflows, there are gadgets is one part, like your scanners, your OPG machines, your CTCTs, taking pictures and all that. These are the gadgets to collect the data. Now, this collection of data in the clinic has to happen. Now, it is not a rocket science how to take pictures. Anybody can do it, either senior dentist, junior dentist, or a non-dentist can also do this. Taking the interval scanning is again, nowadays we think it is a dentist should be done, but actually it's not a dentist job. Any of auxiliary staff member can also do the scanning. It's like shooting multiple pictures at the same time. It's just that one needs to know for what he is scanning, and the dentist can do that part, and the other person can do the scanning for him. Taking OPGL technicity, that is again a technician job. So for a dentist as such, you precisely don't need all the softwares and do this planning and do all this stuff, because that is still, it is a separate business entity within the business of dentistry. So whether you are passionate about it, you can do it. Then you are going to learn so much thing about it, spend so many hours and do it. If you don't want to do that, you delegate that part outside the way you are delegating the dental laboratory work. But before doing dental laboratory work, delegate this part to the experts, get this understanding. Possibly you can have a 3D printer in the practice that also can be managed by an auxiliary staff, not a dentist, and get those tablets out. Try and understand whatever currently you are doing in dentistry in a real organized way through the tablets and perform the dentistry. So for my, if you ask real question, senior, junior, experienced, non-experienced, it doesn't matter. Currently, whatever you are doing, it has to be done in a more organized way. And that is the only thing when it is coming about digital dentistry efforts.
Understood. So when we apply this, you would have helped a lot of dentists apply this new digital dentistry protocol to their clinic. Have you seen any resistance from the staff members that why don't we just directly do the cutting and then send it to the lab, or any resistance from colleagues on adapting to digital dentistry as such?
So I will give you an answer in two ways. One is my own staff, and then some other doctor staff. So first thing is dentist needs to be clear what kind of dentistry he wants to be done. It is an open mind. So for that, there you have to go out of your comfort zone and incorporate certain changes in the way you are. My staff, my doctors, they're completely in awe of whatever we are doing. They completely love what we are doing, and every day there is some muscle person happening in the clinic, some pictures happening, some procedures happening, which is done in a very, very innovative way. So they are all enjoying that part. Now, when we are having these workshops for the doctors, they come, enjoy, and everybody loves the concept. Once they go back, what happens is some of them are used to do in a traditional way. So it is a habit for them. They said, I'm seeing so many patients in a day. I don't have time to take good pictures. The primary requirement is to send the pictures from on which somebody can design a smile. That is the first starting. For that, there is a protocol. Unless you follow this protocol, you will find more difficult photo लेना ही बहुत भारी पड़ रहा है. Scanning ढंग से नहीं हो रहा है. That is also difficult because I had never done a scanning. So this initial flow, if you are tired out of this, then you will not follow that protocol. Those who are open-minded ऐसे कि नहीं यार ये वो करना ही है, मुझे होता ही है. So they enjoy all this process. And as far as their staff is concerned, unless and until you explain your own staff the importance of the work which we are doing currently, we are in a profession where we can actually change people's lives for better. And every day, so much of that is happening. Currently, the way we are working, there is no predictability in the workflow. That is where there is a cribbing happening on the dental chairs in between the patient and the doctor and the dental technicians, and the staff is watching that. So they are all confused about all this. But the moment the dentist realize there is a solution for this, and I want to do it this way and follow this path, they start enjoying.
Understood. So now if someone is inspired by this entire conversation and wants to connect and wants to start this journey, how do they contact with Smile Design?
So we have a 3D planning center in Mumbai, Andheri, by the name of Rich Smile Design. Our website portal is by the name of www.richsmiledesign.com. And we conduct monthly workshops, mostly in Mumbai or outside Mumbai, depending on the number of dentists available for us. It is mostly a 2 days workshop where we call it as a foundation course, where we explain about all these current concepts and protocols in dentistry, where they do not need to invest too much of time and money into the terms of technology. So first step, I would suggest at least spend 2 days, because it's really not easy for me to share the know-how of whatever I learned in 20 years of dentistry, 5 minutes or 2 hours of session. At least 2 days is required to get the whole understanding and what things need to change once you go back. So that is the first foundation stone. And then people can send the final scans to a planning center. It's a cloud-based dentistry. For that, you don't need to really, send pickup and drop boys. All this data is digital nowadays, unless and until you want a final prosthetics, which is to be delivered by the lab. So our own lab can deliver that, or somebody is comfortable with working on other labs. They can just pick up these files and send those to those laboratories, and they can work around those.
Understood. So where do you see the future of digital dentistry in the next 5-10 years? What all is going to change?
So in my mind, currently, the buzz about digital dentistry is going everywhere. So attention is to acquire this digital tool, something called as intraoral scanner in the practice. Once you have intraoral scanner in practice, then you want to invest into 3D printer. Then you want to invest into, okay, now there are some softwares, which softwares, because there is plethora of softwares available. Unless and until you are clear about what kind of softwares I need in my practice, or do I really need those? If I can have only a basic software to plan initial two-dimensional smile designing, the rest of the part can be done by my expert planning center and lab. So this phase currently is a confusion phase for most of the doctors. Unless until they get clear about it, the actual workflow, actual change will start happening from 3 years onwards. As well as my estimate of understanding doctors and psych in Indian dentistry. 3 to 4 years down the line, most of us will feel that, okay, the planning in dentistry is everything. And when we are talking about planning, 3D planning is important. Making the patient's digital clone and deriving information out of that clone. First, make a digital clone, diagnose collectively using interdisciplinary modalities of your own practice. And there are people in the virtual dentistry sitting on the planning center from there, and take this templates and perform this dentistry. And this part of dentistry, this kind of dentistry will become normal in almost in every practice in the next 4 or 5 years. And 10 years down the line, I don't think any practice can survive in India without the use of model, something called as 3D planning center or 3D planning workflows in the practices.
Understood.
This is kind of little unheard modalities as of now, copy-paste dentistry and all that. It's because unfortunately, it's only me probably in Indian dentistry is talking about it on this side. And a lot of people are saying digital dentistry, but digital is very vast. And I'm talking about digital copy-paste dentistry, which is a digital dentistry workflows. You may have gadgets in the practice, you may have software in the practice, or you may not have. But implementation of 3D planning should become the norm of everyday dentistry practice. And next 4 to 5 years, I see it is happening in everywhere.
Understood. So any advice to a young dentist watching this interview?
So for young dentists, I see a lot of posts in social medias and a lot of people talking that, okay, India में dentistry बहुत हो गया है, so many colleges, so many youngsters are coming up, and what is the future for dentistry? I feel at this moment we are in a zone where we are just making go towards the next thing is that this would be called as golden era of dentistry in the next few years down the line, and we are at the cusp situation where it will explode. There are a lot of market for cosmetics, implants, aesthetic dentistry is being opened. People will travel to India at a dental tourism at more numbers, and that will be made available to most of these young dentists. And currently, whatever number of people are going to the dentist is also not that great. Like I recently, what I read is not even 10% of Indian population is getting the dental healthcare done properly. So once that things improvises, there will be a lot more patients for us, and whatever current lot of number of 3 or 4 lakh dentists in India, they will also be not enough, I think. And the quality work will never go west, even if you have 2 or 3. In my opinion, if you really want to do great dentistry, quality dentistry, any dentist practicing like that wouldn't be able to do 3 or 4 patients a day. You don't need 40, 50 patients a day as a clinician to survive and do a good dentist. 3, 4 patients and good quality dentistry, then will never go west. So all those youngsters were feeling dejected that dentist mein kuch rakha nahi hai. You need a little patience, you need a little understanding, and try and separate yourself from the senior lot by adopting digital dentistry and something in the digital dentistry. May not be in toto, but there is something or other thing available for your interest, and newer careers will also be opened. There would be clinicians who love saliva and blood. They can actually be on the, I would say, at the front line delivering the clinical dentistry, and there will be people and say, I don't want to be in the patient's mouth. I don't like saliva. I don't like blood and all that. And like computers, somebody could be on the virtual part of dentistry, helping other dentists by doing this 3D planning for them and providing such kind of services. There are a lot of career opportunities being opened. So it's a great future for all the dentists out there in my.
That's a very positive and inspiring message, sir, because I also personally feel we are at the cusp of dentistry where it is going to tilt towards positive dentistry for everyone. Thank you for bringing that advice out. So now if someone wants to connect with you, how can they do that?
They can connect me on my personal email ID, that is Dr. Aslam Inamdar at gmail.com. And my social media handles are by the name of Aslam Inamdar on Insta. And you guys can also follow It's My Design. That's my 3D planning entity that covers a lot of education about digital dentistry as well.
Great. We'll be putting all these details in our Instagram post. So anyone who wants to connect with him can go there and check it out. Thank you, sir, for taking
Sure.
your time from your extremely busy schedule and joining us today.
Thank you. Thank you, Dr. Satish. It was a very, very nice experience for me. And I feel greatly honored to be on your channel, talking to all the young dentists whose future is bright and a really great time. Thank you so much.
If you like this video, do not forget to go and check out our other videos which you might enjoy.